Welcome back here to another episode of Rooted in Movement, the podcast. And boy, what a wild ride it's been. I actually just got back here stateside from the Tokyo 2021 Olympic Games, helping out my Olympic shooting team achieve their goals and get 6 medals from that experience. It was actually a really beautiful experience. I'm going to do a whole episode recapping that. Just hang tight, hold on to your pants for that one, because we're going to go deep into a lot of the lessons that I learned from that experience as well. But today's focus, today's episode, the purpose of this podcast is on something different. It's been something that's been on the forefront of my mind, something I've been seeing a lot on social media lately, and that's using pain and injury as this badge of honor, or having it as this identity crisis. And I'm here to tell you that it doesn't need to be that way. We don't need to struggle. We don't need to succumb to chronic pain. We do not need to allow pain and injury and everything surrounding that, and from a contextual standpoint, really infect and invade our identity. Because I'm here to tell you that you are not your MRI. You are not your diagnosis, and you're not your pain. So here's what typically happens, right? When we experience pain, we often wonder, what the hell did I just do to myself, right? Like, we've all been there before. I've had my experience tearing my meniscus down in Guadalajara with my Olympic teams, and I told a whole story on that previously. And there's this fear component that settles in, like, what the hell did I just do to myself? And all these different scenarios start playing out in your mind. And I remember, when I tore that meniscus, as a swelling kind of pushed out into my skinny jeans, so did the identity crisis like flood my brain. Like, oh no, what am I going to do now? Like, am I going to be able to move? Am I going to be able to train? Will my girlfriend love me anymore? Am I going to keep my aesthetics, my six pack? And how could I be that movement guy that hurts himself getting into a van of all things, right? So there's a big fear component to this. And in our search for answers to, abate that fear, we flock to Dr. Google, right? And others go maybe to the orthopedic doctor, who is typically going to order an array of different images to, quote unquote, find out what's going on inside. And typically, though, with either path that we go on to, whether we do our own research through the Google machine or we go to another so-called authority figure or authority expert, it leads us to labels, right? We associate a label with ourselves. We attempt to place a name to our pain, like that torn meniscus in my knee is the reason for my knee pain. Or you see those degenerative discs or those herniated discs in your back, that's why your back hurts. Or maybe you've been told that your shoulder pain is a result of some type of impinged rotator cuff tendon syndrome, right? And in doing so, we label ourselves as that pain. And in the same process, we end up losing our identity. Right? We're no longer that adventure racer. We're no longer that runner. We're no longer that weightlifter or even that yogi, right? We become our pain, we become our injury, and we become our diagnosis. And I really want to begin to illustrate this point with a recent Instagram post that was sent to me by a friend of mine. And it's really going to help highlight exactly why we experience what we experience. I'm going to help break this down, provide a little bit more clarity to the whole pain experience and medical imaging, for that matter, and how we associate fear mongering into this fear of movement, so to speak. So this particular individual ended up tweaking their back, doing a forward fold. So the forward fold is a movement in yoga, which actually comprises a lot of the movements in yoga, where essentially it's hinging at the hips and bending forward to touch the ground. That's probably the best illustrative point I can do here via audio. So, and this is something that's been a recurring injury, right? It's kind of like a roller coaster ride where they've been experiencing off and on for years now. And in this particular time, there were 2 incidences that occurred kind of back to back. And they described it as like the pain that came raging back. So I want you guys to pay attention to the word choice here as well, because it gives an idea of the thought processes that are going on inside this person's brain, right? So they state that the second MRI was the second one in less than a year, and it revealed some mild herniated discs, particularly here at the L4, L5 vertebrae, and with an association of scoliosis, just to kind of add the icing on the cake, right? Here's another abnormality that we found on imaging of why you're so broken, right? So here's the thing. In reality, 90% of what we find on images or online, for that matter, is completely innocuous, right? All these scary findings, these pathological findings, Like, for example, and this is actually really mild compared to what we typically hear of like, oh, your back is like that of an 80-year-old when you're really only 25 years old, or, those discs are squirting out your back like a jelly donut. Like, think of these images that are now in your brain and how that makes you feel. Like, tune into that, right? It doesn't sound very nice. It doesn't sound very comforting. They're really scary in nature, right? And in reality, they're just natural wear and tear of getting older and being an active human, right? So based on our activities, what we choose to do because we love it, will have an effect on our structure. It dictates how our body adapts and evolves over time. Me in particular, playing baseball for so long and being right-handed, I spun and turned a lot to my left to throw into bat. So if we looked at my back and got an MRI or an X-ray, I'm pretty sure we're going to see some likely degenerative changes going on the left side of my vertebrae down there at maybe the L3, L4, L5, L5S1 vertebrae as it comes there into the sacrum. Because the L4 and the L5 vertebrae are the two most mobile vertebrae in the spine, right? We need a lot of motion there. We want a lot of motion there. That is what they were designed to do. And because of our activity, because of our movement patterns, our body is going to adapt based on the stresses that we impart to it. Okay. This is not a bad thing. Okay. This is the body naturally adapting to stresses based on the way that we're moving. This is supposed to happen. This is the natural wear and tear. If you are into weightlifting, if you're into going to the gym and running, you are likely going to have more changes in your spine than somebody that lays around all day. However, the person that lays around all day isn't healthy, right? You are better off not being sedentary and going out and beating your body up, for lack of a better term, for the sake of doing something that you love and not having to worry about what's actually going on inside your spine, right? These are things that are naturally going to be occurring, and it's okay to have them occur. Also, aside from the structural things, like we notice that there's a pain response to this situation. Well, pain is just information, right? And we need to be careful how we actually decide to label it, because pain will actually guide us to better movement if we take the time to actually slow down, breathe, and seek to understand it. Okay. It's your body, it's your choice, and you have the power to decide what is going on inside it and how you feel about it, right? We need to find me included, we need to be able to surround ourselves with people around us and find rehabilitation professionals who actually understand movement and who understand pain and who understand you in particular, because that is what's going to make the difference as far as outcomes are concerned when we are in this painful or in this injured state. Now, this L4, L5 vertebrae, in particular to this case that we're talking about here, in addition to being the two most mobile joints in the spine, okay, so of the vertebral bodies down there in the low back, this is also the location of our center of mass. So you can think about your center of mass as being the aggregate of everything around you, everything that makes you you. Right? So your fat tissue, your muscle tissue, your bones, your skin, your hair, everything makes up your center of mass, and it's located at your L4, L5 vertebrae, which is about an inch below your belly button. Okay, so just to give you a reference point there. And that reference point of the center of mass is essentially how we control ourselves, right? How we move through our environment, how well we can stabilize and control our movement patterns against different perturbations so we don't get knocked off balance, so to speak, or how efficient that we look with our movement when we are participating in an activity that we enjoy or a sport that we're trying to play. Okay. So those two vertebrae, in conjunction with being our center of mass and the most mobile joints, are really important, right? Because our pain and injury and our stability and the mobility that we have is dictated based off of our ability to expand our base of support and to control more movement around that center of mass. So the more that you can control, so the wider breadth and the more capacity that you have, the less likely you are to injure yourself or to experience pain. From an injury standpoint, most injuries occur at the end range of our motion, end range of our flexibility, so to speak, where we can't control that anymore. And what happens is we exceed the capacity of those tissues to handle force. And what ends up happening is some type of pathological tissue damage, right? Or we strain these muscles, these tissues, these ligaments, these tendons so much that the brain gets defensive over it and we send out these pain signals. an effort to stop us from going into that range of motion that we could potentially hurt ourselves in. So that's the important part here, is that the pain is just information. It gives us information in order to provide us with the basis to change the way that we are moving. Okay. Now, the second piece of this puzzle is that the injury required no surgery. Okay, well, that's great. All right, I'm actually really happy that these providers didn't place this person in the category of needing surgery based on what they saw on the image, because having a mild disc herniation isn't a prerequisite to needing surgery. And I'll be honest with you too, I would never even ask somebody to go get an MRI or an X-ray or anything for that matter, unless they couldn't control their bowel or bladder, or they had really intractable throbbing night pain that just wouldn't go away. Okay, those are really the only two reasons that would necessitate anything like that. That could be a red flag, it could be a medical emergency. But if we're just talking about generalized chronic mechanical low back pain that's really non-specific and comes and goes based on our movement patterns, there's really no reason for that whatsoever. No reason to get an MRI, no reason to get surgery. Now, the prescription was to do some physical therapy and to get a few weeks of rest. Okay. Not a bad plan. Okay. Now we do know that the physical therapy is going to change. It's going to differ based on the individual and the philosophy and the school of thought. The one part I do really have a problem with, though, is the few weeks of rest. That's an issue. Rest is the enemy here. Okay. Rest is going to make things worse, because the more sedentary that we are, less movement that we provide our body, the less nutrition that we can actually impart into all of our tissues, and the more psychological ramifications that we are going to incur. Okay, now here's the worst part about this, though, is that these individuals, these providers, gave the advice that in order for the back to truly heal, that this person was not allowed to forward fold. Okay, so think about that. Not allowed to go into the movement pattern that supposedly produced the pain. Okay, so instead, they were given the instructions of squatting down, instead to reach down, like to pick something up off the ground, or to perform some daily household tasks like filling up a dishwasher, or to pet the dog, something like that. And then, of course, when it came to yoga, like we said before, most of these yoga poses involve some type of forward bending. Okay, so this means now that individual is no longer performing the movement practice that they enjoy. Okay. This is what we call fear mongering. Okay, this is fear mongering with movement, and it makes things worse. The reason why is because it causes kinesiophobia within the brain, where the brain now fears these particular movement patterns. Fear bending forward. And here's the thing, with enough rest, that pain might calm down. If you let the tissues, not incur any stress, it's the potential that those pain signals will go away. But then what happens when we go back into those movement patterns that we once like to do? There's a higher likelihood that the brain will then still find them defensive because we did not perform them for such a long time. Okay, it'll be fearful of going back into them subconsciously. Okay, you may have the conscious thought that, hey, I'm fine going back into this, I'm not in pain anymore, but subconsciously the brain still feels a threat. And this comes down to the limbic system, or that part of our brain that's the oldest. Okay. This creates like this paralysis by analysis, this splinting effect in your nervous system. It's really like part of the sympathetic fight or flight response, okay, which actually will tighten things down. Because if your brain feels like it can't control or go into a range of motion, or it's fearful about going into a range of motion, it will neurologically tighten you down or send those signals of pain, like we talked about before, in an effort to prevent you from potentially going into a movement pattern or a position or a posture that you could potentially hurt yourself in, whether that be right or wrong. That's the brain's defensive mechanism surrounding it. Instead of this, though, we should be encouraging movement, right? We should be encouraging this individual to forward fold to tolerance, to go to yoga, to go and practice yoga to tolerance, okay? To be able to move and be in that environment where they feel good. Okay? That's going to have a way more of a beneficial effect as we work on looking at truly assessing from a psychological and an emotional standpoint why going into this pattern is a recurring theme, right? Why it is turning into a chronic pain response. There is going to be some type of instance or a trauma that could have been imparted long ago that it's once again lying dormant and lying in the subconscious that is the source of this problem. So the way that this works is, if you experience some level of trauma, it could be physical, it could be emotional, psychological, spiritual, sexual, it doesn't matter. The brain perceives it the same way. It perceives it as stress. This stress is going to cause some type of dysfunction in the body, which is normal. And that dysfunction is going to lead to some type of compensation patterns if the dysfunction is allowed to go on for long enough. These compensation patterns are going to lead to accelerated tissue stress into very specific tissues because they're the only ones that we use over and over and over again, which is then going to lead to one of two things, one being either pathological tissue damage, like we talked about before, or pain. Okay. Pain that leads us into more compensation patterns. And either way, we keep going around and around and around this vicious cycle because we never got back around to the source of the problem to begin with. Now, when it comes to people who perform yoga a lot, they're very, very mobile, right? They're very, very flexible. This is actually a great quality trait to have. The problem becomes is when we actually go into these patterns over and over and over again, and sometimes we're not actually controlling them, right? We're going into these postures, we're going into these positions, and we're just utilizing our passive structures to hold us up. Okay, so our ligaments, our tendons, our joint capsules, the vertebrae of the joint capsules, for this example with the low back, you could be moving into a position that you're not controlling, and we just keep stressing out these passive structures, which in the short term isn't really a problem. Okay, it's not really an issue until it does become one. And this is coming down to how we are actually interacting with our environment, how we're moving through our environment, how our feet are contacting the ground, and what structures that we actually prefer to use that make us good at that particular sport, at that particular movement when it comes to yoga, that discipline, which is totally fine, but we are missing pieces to our movement health puzzle. Okay, we are missing this aspect of control, we are missing this aspect of strength, and that's why doing something along the lines of stretching or even soft tissue work in this case wouldn't be warranted because it's still very passive in nature. It's not teaching the brain anything new. It's not teaching the brain anything different. It's not teaching the brain how to move differently. Okay? Because at the end of the day, there really are no bad movements, right? There are just movements that teach us. They teach us something about our bodies. Ultimately, the same can be said for our choices in life as well. There are no bad choices, just choices that teach us different lessons. So when we take responsibility for our choices with movement, we start to see the world differently and we start to see movement differently. Things don't just happen to us, folks. There's a reason hidden deep within these experiences, these movement experiences, these lifestyle experiences, if you choose to actually look for it. Pain and injury are really no exception. Okay, we make choices every single day on how to move or really to not move our body. There's two different ends of the spectrum here, right? We choose to put ourselves through brutal workouts. We choose to ignore pain, to place a blame on pain, to label pain, or to push through pain. We also have the choice to move ourselves through pain or to sit idly by and hope someone or something is going to save or to heal us. And that latter is the most important aspect here. This is the part that gets really kind of irritating from my professional standpoint, my philosophical standpoint, is that we shouldn't be waiting for someone or something else to save or heal us. Okay, this is a dependency model. This dependency model is what has put our medical system into the state that it is currently in, with spending the most per GDP on medicine, yet having the worst outcomes as far as obesity and heart disease. And even when it comes to all these joint replacements and orthopedic issues that we see plaguing us, we do the most amount of surgeries, knee surgeries, hip surgeries, spine surgeries out of any country, and we still have the highest incidence and rate of chronic pain. Does that make sense to any of you? Right? There's definitely a problem here. So if we were doing things right, we wouldn't have us in this situation. Okay. So every single day, our own movement, it gives us the insight into how well our body is actually functioning and how well it is actually handling stress, if we are willing to listen to it, and if we find a guide who's been there before that can tell us that it's going to be okay and calm down these fear-provoking fight or flight responses. Okay. So moving on into the post, it was getting worse and worse. And struggling really hard with it. Okay, so these are some really important words here because it's been getting worse and they've been struggling, and they state that yoga has been their everything, right? So they state that not having this practice is tough. And here's the thing, movement is extremely vital for our movement health, okay? So limiting some of this is we're going to see negative ramifications from a psychological standpoint, okay? It's frustrating. Another very impactful, important word that they use here. Okay, so they spend their life, their weekday, I guess, at a desk every single day, and they look forward to going to this yoga practice in the evenings to close out the day and to feel good about their body and to move energy. And the fact that we have medical providers that are preventing that or saying that that is bad for them in the moment, we are doing them a disservice. And reality here is that there are, hundreds of millions of people with chronic pain in the US constantly, okay? So the more and more that we stop moving, the more and more this chronic pain issue is going to exacerbate, okay? So that's really, if you look at it from a statistical standpoint, 30% of our population is in chronic pain at any given time. And what it boils down to is it's a locus of control issue where we're not taking responsibility for ourselves because we don't have confidence, we don't trust in ourselves. So therefore we take the words of some authority figure who is now removing something that we enjoy from our lives. Okay, external locus of control, right? And this is coming down to an educational piece, which is why I believe that this podcast that I'm doing right now is so impactful and so valuable for many people, because there are so many people out there dealing with chronic pain right now. And what ends up happening is the reason why this is such an epidemic in our country is that we teach people that we are in this victim mode. We are in this victim to our pain, and we are dependent on others to fix us and take it away. The problem is that this palliative approach to treatment, it actually further exacerbates the problem because we don't ever ask the right questions to address the root cause of the pain, like I just described earlier. So you can think of chronic pain as kind of like skiing downhill on the same path over and over and over again. The more times you go down the hill, the deeper the rut you're going to form. This rut is your pain. Okay, so it's time to take a new path. It's time to take control of your body and your movement and enhance your vitality. And we do this by moving differently. Okay, so just like this individual who is, taking a few weeks of rest and doing a lot of soft tissue work like cupping and massage and dry needling, these are all passive modalities that are being imparted onto us by somebody else. So once again, reinforcing this dependency model and never having changed the movement pattern in the first place. So this person yet may feel better because that's all these passive modalities do, is they create this window of opportunity that we, to help us move better because they do make us feel better. But at the end of the day, they're just that. They're temporary. They're Band-Aids. They're like, the best analogy I can use for this is if you ever hit your knee off of a coffee table and you rub it really hard, okay? It scrambles the nerve signals and it makes you feel better. That's like your instinctual pattern to do, right? You want to make it feel better initially, so to rub it hard, and it does. It does make it feel better temporarily, but it is just a Band-Aid. It's not fixing the problem, right? And that's what all these modalities do, is they create a stimulus, an input into the nervous system that calms it down temporarily, because it's usually stronger than the actual pain that they may be feeling in that moment of those sensory receptors being signaled, okay? And here's the thing, I really have no problem with any of these passive modalities. I think they're great tools when used appropriately, but they can't be the only form of treatment. They're great as long as we now reinforce that with better movement. We reinforce that with a new way of moving. We reinforce that with giving this person more movement opportunities that gives that individual more movement options when they actually get back to the activity and the sport and the movement patterns that they love, in this case, yoga, right? And here's the thing. At the end of the day, we're never going to always be completely pain-free. It's never going to happen. So we should learn how to move with it. We should learn how to understand it better, okay? If you woke up in pain today, you should be grateful that your body is actually providing you this information necessary to make it change. It really is a beautiful message our body is giving us. So instead of trying to control it, we should seek to understand it. And this is the essence of my Rooted in Movement logo, the logo that I tattooed on my leg. Okay, these concentric rings of a tree trunk that represent the growth and evolution and expansion of human movement. But the rings are chaotic in nature intentionally, right? They're chaotic in nature because life is messy. And instead of seeking to control it, we should seek to understand it and grow with it. That's the big message here. That's the big message that we're going after here. Rest is the enemy. These passive modalities are nothing more than band-aids. They could be a useful modality to help us move better, but at the end of the day, we need to move better. We need to have somebody that is in our corner that can look at us, that's somebody that we can trust, somebody that we have confidence in to help guide us and educate us, to take power back over our body, to be autonomous, to empower us to move better, to empower us to move more, even in the face of pain, even in the face of discomfort. And instead of running away from it, treating it as an old friend. Okay, treating it as a friend that's come over, sit down with them, talk to it, learn from it, and seek to understand more about it instead of running from it and trying to get it taken away as quickly as possible. Movement is going to build confidence in your body, so we need to keep going. I hope you all enjoyed this episode, and if you know of anybody who would benefit from hearing from this, please send it their way. I think it's vitally important that we get this message out to as many people as possible who've been dealing with chronic pain and have been on the roller coaster ride and the merry-go-round of seeing various providers and different manual therapy skills that quite honestly are temporary in nature. And until somebody gets to the root of the problem and actually sits down with that person and listens to them, understands who they are and what they like to do, what they find enjoyment out of, and builds a connection with that person, we're going to keep moving on this hamster wheel, right? We're never really going to truly get to the source of the problem because we've never got to know that individual, what makes them tick, what makes them think. And we never made any lifestyle changes. We never made any movement pattern changes that are going to change the stress load into these particular tissues or into the stress of the mind and how it's handling these situations. Because at the end of the day, our thoughts, our feelings, and our actions, they change the chemistry in our brain. They absolutely change the chemistry in our brain. And when we change the chemical makeup and the chemical milieu that's occurring inside of our head, it's going to change the way that our body functions. It's going to change the way that we hold ourselves. It's going to change the way that we move ourselves throughout our environment, throughout our day, and it's going to change the way that we interact with our loved ones. With that being said, if you found this podcast useful, if you like listening to it and watching it on the YouTubes, please go ahead, give it a 5-star review. And I cannot wait to see you guys and talk to you guys in the future and be able to impart more words of wisdom out there and be able to help more and more people regain confidence in their body. Because at the end of the day, your confidence is rooted in movement. I am Thor.